over the course of about 5 years, I was on the executive committee with the chief surgeon and the chief of anesthesia and the vice president of nursing. So it was hospital and medical leadership. And we were able to make changes to the way space was reserved, to the way it was evaluated, move in and out based on utilization. We created some release processes, generated over $100 million in incremental case revenue with an 11% reduction in staffing cost over the base period. And all now, price increases were factored in. So, that's a bit of that, a good chunk of that. But the point is, they had the technology and the expertise on site. They just weren't using it to its fullest. And that's going to be one of the keys as we transition. Tom?
Yes. Going back to the 1990s, in hospitals and hospital systems, and people that have been involved in that, I think, are real sensitive to this. Capitation or risk-based reimbursement. And I was the vice president of healthcare finance for Blue Cross of Ohio during that time. And I can guarantee you what we did in risk type arrangements was to pass on the risks to the provider, in this case, hospitals and systems, and said, good luck. And they did not have that power of the data. And the end result is financial losses were critical. So as we get into an environment in the future that is going to be more risk-based, the power of both clinical and cost data is so important for the success and the difference between winners and losers. So I just echo all the points you just made, Ralph.